Hi, my name is Gwen McMillin, and I'm a Medical Director of Toxicology at ARUP Laboratories. I'm also an Associate Professor of Pathology at the University of Utah. Drug testing is an important tool in many medical settings, such as characterizing an acute intoxication in the emergency department, for chronic management of therapeutic drugs, to verify adherence in a pain management setting, as well as to qualify patients for surgery. Medical drug testing is not well standardized. As such, it's important to have a fundamental understanding of the strengths and limitations associated with various technologies applied to drug testing. The most widely used technology for drug testing is the immunoassay. Part of the reason that immunoassays are so widely used is that they're quick and easy and relatively inexpensive. However, there are a number of concerns about specificity and sometimes sensitivity of immunoassays. Some of the variables that may contribute to false positive or negative results include the antibody upon which the test is designed, the actual design of the assay, the calibrator that's used, and the cutoff concentration. For example, to detect opioids, one might lean towards a traditional opiate immunoassay. The traditional opiate immunoassay is designed to detect morphine and codeine. As such, it's unlikely that some of the synthetic and semi-synthetic opioids, such as oxycodone or fentanyl, would be detected with that assay. In fact, to adequately detect most common opioids, one might have to use up to a dozen unique immunoassays. Another approach to drug testing is to separate the components of a biological matrix and identify those components individually. The most common way to separate components in a biological matrix is with chromatography. Chromatography, by definition, includes both a mobile phase and a solid phase. The mobile phase is typically either liquid or gas, and the components in a biological sample will migrate in that liquid or gas phase. Those components will then interact with the solid phase and be retained for various amounts of time. So the retention time required for a compound to elute from the solid phase is used to help identify that specific component. The other thing that's required to identify that component is a detector. And that detector will recognize unique physical or chemical characteristics of an individual compound. In drug testing, a common combination of chromatography and detection is GC with a mass spectrometric detection, or GC-MS, or liquid chromatography, LC, coupled to either single-stage mass spec or some other type of mass spectrometer. In general, chromatography coupled to mass spectrometric detection is going to be much more specific than an immunoassay. We and others have recently applied liquid chromatography coupled to time-of-flight mass spectrometry, or LC-MS-TOF, to the detection of drugs. The advantage of this approach is that we can detect multiple analytes at once. So a single assay could detect dozens of parent compounds and unique metabolites, which gives you much greater confidence in the result and also affords much better specificity than what might be seen with an immunoassay. So it's potential that this approach could replace the need for an immunoassay or the need for any secondary testing. Another potential advantage to the time of flight is the shorter turnaround time because the secondary testing or confirmation testing is not required. This approach has been applied to blood, urine, meconium, umbilical cord, and potentially other specimens as well. I would encourage you to consult our website at aruplab.com and the peer-reviewed literature for more detailed information on these specific applications.